Hey everybody, Steve Knight with another Consensus Medical Systems Blood Flow Minute. In my last video, I shared this waveform and I promised that I would spend more time on the topic of monophasic waveforms. Today, I'm only discussing peripheral artery waveforms. Sometimes when we hear the waveform's monophasic, we start to assume a worst-case scenario. Well, take a deep breath, study the waveform, and let's see what it tells you. Here's the question. Which one of these patients has arterial disease, A or B? Hit the pause button if you want more time to study the images. It's a trick question. While one might think that waveform B is abnormal because it's monophasic, these images were taken from the same patient in the same location about 4 minutes apart. Did the patient develop PVD in 4 minutes? Pretty unlikely. What other explanation can you give for this rapid evolution from multiphasic to monophasic? This is an example of a change in sympathetic tone. It can be caused by something as simple as a person with sciatica laying on the exam bed with their leg in a position that irritates the sciatic nerve. Waveform B should be described as antegrade, monophasic with rapid systolic rise and mild to moderate resistance. It also has laminar flow. Does it herald an ischemic limb? Hardly. Here are two other examples of monophasic waveforms. There's no denying something abnormal here. These both have low velocities, prolonged systolic rise, and spectral broadening. Some people call these waveforms tardus and parvus, from the Latin for late and small. One could also describe them as dampened. These monophasic waveforms should both be described as having rapid systolic rise, suggesting that there's no significant obstruction proximal to where they were obtained. The diastolic segment of the waveform, however, suggests a high degree of peripheral resistance in the top example and low to moderate resistance in the bottom example. Both of these examples are taken proximal to an occlusion. While I could spend hours discussing hemodynamics, and I mean hours and hours, I want to emphasize the need for standardization of waveform nomenclature. Arterial spectral Doppler and analog Doppler waveforms should be reported using key major descriptors: the direction of flow, phasicity, and resistance. Modifier terms may be incorporated to provide additional information about waveform appearance. And as always, physiology first. All arterial duplex studies should have a physiological correlative study. This has been another Consensus Medical Systems Blood Flow Minute.